As the recording button starts up, you should see the presentation. And I just want to let everyone know that right now you are being recorded. Over to you, Elton.
Good morning. Can you hear me?
Indeed.
Well, I woke up this morning.
Oops. Unmute yourself, Elton. Sorry.
There we go. Okay. I woke up this morning on the radio hearing that 3,000 Americans had died yesterday from this virus. So we should keep their families, the healthcare workers, the public health officials in our prayers. A sobering statistic. Well, I'm going to talk for about hopefully a little less than 20 minutes, and then Stephen will leave the Zoom link up for Q&A for as long as people would like to ask questions, but feel free to drop off at any time. So what could the Biden administration do to defeat COVID-19, and what have we learned from Asia and Europe? So this is a chart that shows the cumulative fatalities adjusted to 1 million people. So it adjusts all the countries to pretend as though they had 1 million residents living in them. And you see the United States has blown past 800. We're approaching 1,000 inhabitants per million people. You can see the Pacific Rim democracies, Australia, Japan, South Korea, New Zealand, Taiwan, there on the bottom, having been far less affected by this disease. The difference really is stunning. For every one person that's died in one of the Pacific democracies, 50 have died in America. It's the area under the line that represents the total number of fatalities. So you can actually envision people stacked like logs, and you get some sense of what a 50-fold difference is between what's happened in Asia and what's happened in the US. In this chart, I include some of the most talked about countries in Europe. So see Taiwan through Australia at the top, California, Sweden doing worse than California, but a little better than France and the US. And then the UK, Spain, and Italy, which trade places every month for leadership in something you don't want the leadership. And again, the area of the bar represents the number of people that have died this year in those countries from coronavirus as of the 8th. So what we want to do, and what the question really is what can we learn that we can use now? Of course, in the beginning, the World Health Organization and the CDC vastly underestimated the importance of masks. You can read now there are over 50 articles on scientific literature, peer-reviewed literature on mask wearing and the effectiveness of it. So what we know now that we really didn't know at the beginning of this, if you wear a mask, you are less likely to catch COVID-19. If you do become infected, you're less likely to have symptoms. That is, that when you become infected wearing a mask, you get a less severe form of the disease frequently. You're less likely to be hospitalized, you're less likely to die. And if you become infected and you wear a mask, you're less likely to pass it to a family member. So masks really are miraculous. So in the beginning, Asia chose masks, rapid, clear communication and action. The West chose inaction, muddled communication, and lockdowns. We had 50 times as many deaths. That ratio has been very constant. It's held constant since March through the end of November. It's getting a little bit larger now. And of course, we've had vast economic disruption. Asia has had strong economies, very little unemployment, and 1/50th as many deaths. I love this cute little chart. Masks are powerful, but what we know now is that if you try and go it alone with just masks, you also end up in trouble. So I've read hundreds of reports out of Asia, and the Pacific Rim democracies that have contained major outbreaks of COVID-19 have taken a suite of actions that together have proven amazingly effective. It is the only formula of the several hundred formulas and interventions that have been tried around the world that works in large country democracies. Every other country that has tried, and state for that matter, that has tried a different strategy is now undergoing a surge. Europe, even Canada, and of course in the US. So given our current situation, what should we do and what can we learn? So these next couple of slides are taken from an earlier presentation, earlier white paper. And if you're interested, you can download and read them, or I can send them to you. So one thing the Biden administration has to get right is the basics. So the first three there have to do with masks. We've got to turn around the misinformation on masks, get people wearing masks in all indoor settings and in some outdoor settings. We need a national scorecard that allows us to see where the sources of infections, the super spreaders, the overfull hospitals, the deaths, and so forth are. And we need, the Congress has passed, but the administration has not spent money for testing. We not only need quick, low-cost tests, we need canine sniffer dogs. They have proven the most accurate method of testing so far, more accurate than most, if not all, of the commercially available tests. And we need universal sewage water testing. That's it gives us at least a 5-day early warning on an outbreak, and it can tell us within 48 hours whether mitigation strategies are working, and they can also often identify blocks or buildings in which there's an outbreak. We need to publicize best practices, and we need to do a much better job with simulation and visualization tools. So in Japanese television, they've been showing videos like these that show how the virus spreads in a room. This gentleman coughed 15 minutes ago, and you can see how the virus wafts through the room even 15 minutes after he coughed. We also need to focus on stopping super spreader events. They account for between 1/3 and 2/3 of all infections. And we have done a very poor job, and I would expect the new administration to do a much better job on the super spreader front. Just as a reminder, most, but not all, but most super spreading events involve more than 10 people. They're indoors, they're unmasked, and they last more than 30 minutes. Jails, nursing homes, retirement homes, bars, weddings, and the like. So this story is a piece of the story that no one talks about. So, and it's the critical role of information technology. So we need a national contact tracing system. Having county by county contact tracing does little good for flight attendants and truckers and a myriad of other people who travel. We need the ability of our healthcare workers to see where the cell phones are going. We're the only, every country in Asia that has successfully fought this virus has used the cell phone records. Here, you can allow people to opt out if you want to. Even if everyone on Fox News opts out, these are incredibly powerful. South Korea says they contact trace 30 times faster when they have access to the cell phone records. And then, of course, we need to develop a mobile app. No one in the West is using a mobile app that works as effectively as those that have deployed in Asia, which use GPS data. And in the West, for various reasons, it's not done that way. So South Korea has produced a guide. It did it back in May. Interesting, the name, using ICT, information and communication technology. I kept thinking there would be a companion manual of the other things that you had to do. This is the manual. This is their strategy of using information technology to flatten the curve. So they've made an 80-fold difference adjusted for population for every one person who has died in South Korea. 80 have died in the US. I can't find a single piece of advice in this well-documented English manual, screenshots, flow diagrams, and the like that the US government has followed. We need to do a better job on the communication. We need social media and media campaigns. The new administration should start its weekly briefings. It should borrow Steve Kornacki with his whiteboard loaded with COVID-19 data so people can understand more easily what's going on. And we have to find someone who can go head to head with these Fox News personalities to begin to get a voice of sanity on Fox. Mayor Pete's the most unlikely candidate, but the most effective that I've seen yet. Not talked about much, but the Kremlin disinformation on COVID-19, amplified by Fox, is a major problem. There is a website in Europe that does a fairly good job of tracking each campaign that they launch and which of the media outlets picks it up. But almost every bit of misinformation you have heard about COVID-19 either originated in the Kremlin or was amplified by their folks. We have to do something about foreclosures and evictions. This just, it scars families for a generation. We should freeze them, and we should implement a second mortgage program for any homeowner or small business without requirement that wants their mortgage paid, and then they should be tacked on as a second mortgage to their primary mortgage. A similar program was used by FDR, and it was very, very successful. It actually, when the last loan was paid off in '53, it actually netted a profit for the government. Likewise, we should do that for commercial landlords, and all forgiven rents should be allowed to be tacked onto their mortgage, and they should be picked up and essentially paid for by the Fed. This would interject billions into the economy and prevent thousands, if not hundreds of thousands of foreclosures. The story with essential workers is just really sad in many ways. A couple of things that I tease out want to mention. Any medical testing or funeral bills for essential workers and their family that have not been paid by insurance or employers, the government should pick up. Any essential workers that are evicted, foreclosed, homeless, or have lost their jobs, we should make sure that they're housed. And then we've got, it appears, several million essential workers, medical professionals, doctors, med students, nurses, firefighters, EMTs, meat packers, it's a long list, who are tied up in with problems with ICE. Many of them are working at jobs that are essential, but by taking the jobs, they jeopardize their immigration status. That's all that nonsense should go away. So one example I think really gives us hope, and that is Victoria in state in Australia. That's where Melbourne is located. It's the smallest Australian state. It's about the size of Nebraska, a little smaller than Nevada, I think. They were really hammered in their second wave. You can see here, they really did a good job until the end of June, and then out of nowhere, it just slammed them. And we have many states in the US who had a similar experience. They blew through the first wave, and then in the summer or the fall, this really hit them hard. They did something no US state did. They announced a Go for Zero program. Not bend the curve, not flatten the curve, go for zero. And it turns out the countries that have done that have found it easier to go for zero than flattening the curve. At least the countries that have done it have been more successful. So they locked down their borders. They kept all those people from Sydney from vacationing in Melbourne. They had a mask mandate. They required a QR code on your phone to enter all businesses and restaurants. So the health officials could tell immediately where people were, and they contact traced and monitored every case they had. So the result, as of the day before yesterday, when I checked, 39 consecutive days with no new cases. Well, let's contrast that with Nebraska. Victoria has Melbourne hospitals that are coronavirus free. In Missouri, in the last 14 days, we had 750 deaths. So we've been losing in Missouri more than 50 people a day. And we had 53,000 new cases over 2 weeks. I can't even do the math of how many new cases per day. So a thought experiment. What if COVID-19's profile of those injured was like polio? You may remember that polio attacked the young and the affluent. And passed over the elderly and was a less serious problem with the poor. So if America, just work with me in a little thought experiment, was losing 50,000 children every month and leaving another 100,000 young Americans permanently scarred, and masks and mobile phone apps could save thousands of white children, but elderly people and people of color refused to wear masks, didn't want to use cell phone apps, didn't want their county health officials to know their location. So we were losing 50,000 children from affluent families every month, and another 100,000 were permanently disabled. What would a new president do? What should a new president do? Well, he might, or she might, give the states 2 weeks to mask in an attempt to save more than 10,000 of its citizens each week, and then declare martial law in the counties that were unable to get it done. But that is our situation. We are going to lose 50,000 Americans each month in December, in January, in February, in March. April is the first month that any statistician says that there's a hope of getting us below 50,000 American fatalities. And for that to happen, a number of things have to happen right. So on Inauguration Day, the high models show 4,000 people a day dying. The mid-range models show us right about where we are now with the curve beginning to flatten. The most optimistic models, where people start wearing masks and we really get this in hand before the new administration, show us at 2,200 a day, 66,000 a month, but at least beginning to decline. But very few will be the children of the affluent. Almost all will either be elderly or poor or people of color. So a vaccine is going to save us this time. But what about next time? What about in 2020X, when it turns out the next pandemic, it turns out the vaccine's difficult to develop, that it's more like HIV or syphilis or malaria or dengue, and those diseases have eluded vaccines for decades. And if our response is 50 times worse than Asia, and this drags on month after month, year after year, it's hard for me to believe that the Western democracies will survive such an onslaught. So this presentation, it can be downloaded, and I imagine that there are some questions.
Absolutely. So if anybody has a question, firstly, thank you very much. There's a lot of folks I can see giving you a silent applause in the background. So thank you very much for that, Elton.
Thanks, Steve.
Oh, there's thumbs up. Now everyone's going crazy. This is awesome. The party has ensued. So if you have any questions, please raise little blue hands. And right now I see a whole bunch of hands being thrown up. The first one coming from Mr. Grindley. William, go ahead.
Hi, congratulations, Elton. It lived up to everything I had heard from Chuck Marsh about it and more. My only question is a technical one. What in the sewers signals that there's COVID present? I just didn't pick up the connection between sewers and COVID, since we have been told that connection is airborne.
Well, it is, but when you pee, you shed the virus. And
well, that's fine. You answered.
And this is very powerful. It gives you a 4 or 5 day warning. So, for example, Boston right now, the amount of virus has gone up 5-fold in the last week. So they haven't seen an uptick yet in their hospitals to match that. But if you were running an ER in Boston, one should be terrified. Likewise, on college campuses, you can track things to a dorm or even to a floor. And conversely, when you implement measures, normally you have to wait 2 or 3 weeks before you can tell if your intervention has been affected, whereas from the wastewater, you can usually tell within 3 days whether people are changing their behavior the way that you have asked. And people are, you might think, well, we're at the end of this pandemic, everyone will be vaccinated by next Christmas. Why make the investment to do any of these things? Well, first of all, we've got at least 200,000 lives, maybe 250,000 lives at stake in the interim. But second of all, we have to learn how to do all this stuff. This is not a one-time event. And so we should do it right now, even though we're doing it right 9 months late.
Thank you, William. Next question from Linda Lenoir.
Thank you, Elton, for really a very thoughtful and thought-provoking presentation. So having a daughter that lives in Australia and having a daughter that lives in Bangkok and having a stepson who's actually been working with the company who's working on the vaccine in London, to hear from them, they're just like horrified at what's happening here. And I think I'd like to go back a little bit to your thought about communication. And we all know, we don't have to really talk about it now, the lack of communication or false facts that have been out there now for 9 months, which is really in everyone's thoughts, right? So going forward, I can't agree with you more. What I'm hearing over and over again, I work with some doctors who are also doing some of this research, that really it's changing the mindset is not going to be easy. And Biden is really going to have his hands full, and rightly so, for especially people of color. I mean, there's so much history back there of why they should be skeptical about a vaccine. And so the more that everyone can really think about in our own local communities of how to educate our community using faith-based people, using athletes, using anyone who has leadership and is famous, musicians, to get the message about the importance of the vaccine is going to be critically important, because there's so many people already saying that they will not take the vaccine. And so once again, we have to be, it's a trite to say, but it's not trite to say we all have to be doing this together so it will work. And even though the vaccine's there, continue the distancing, continue the mask, continue all of these things that we have been doing all along. We don't stop any of that. So thank you for your presentation. And really, I hope that we even do more and maybe can think about how we can start educating even our own community locally. Thanks.
Yeah, the end game is that we're wearing masks until about 80% of our community is vaccinated. Another question.
Absolutely. Thank you, Linda. Next from Sally Mahoney.
Hello, Sally. You're muted. I can see your lips moving.
Okay. It seems to me that one of the differences between Asian countries and the United States is that it isn't just persuading people that the vaccine is safe and effective. It's a matter of persuading people that this thing exists. There are lots of people, I ran into one yesterday, who believe that this is a hoax and that there really isn't a virus spreading in a way that's worse than the flu. That kind of communication is going to be hard to deal with.
So my view of the world 5 years ago was you elected a president to run a government, and on the side, he did a little PR. That you looked at the president's day and maybe he spent 95% of it doing real work and 5% worrying about the media. But that wasn't his primary job. We have now seen a president who has flipped that from the historic average. He spent 95% of the day watching the media, tracking his ratings, and generating a story for prime time that evening, and then 5% of his day governing. And I think we've learned that the new administration has got to devote more than 5% of its energy to communication, story management, rumor management, misinformation. This is now gone from being a small piece of the White House's job to maybe being the most important thing to saving lives. Other than the vaccine, being able to tell this story correctly and have people that can go head to head with Hannity, with Laura Ingraham, the whole crew, prime time, it's really a change in mindset. You wake up and you go, what is Fox News going to show tonight? And how can we interrupt that if it's going to cost lives?
Thanks.
Another question. Thanks, Sally.
Thank you, Sally.
Love questions that let me get on my soapbox.
Next question from Linda Clever. Linda? And you're on mute.
Hey, Linda.
Thank you. Thank you very much. Just a superb right-on presentation. Well said. And I love the most recent chat asking your permission to send this on to Biden. Yes. Yesterday, there was a very interesting, and others may have seen this as well. The editor-in-chief of The Economist had a webinar on a review of 2020. And I just add just a couple of comments. One is that the consensus was that this experience, at least in the United States, may add value to the mere concept of competence in leadership. And we have not had competent leadership for the last several years. And it may be that that value and that trait will be seen as far more important than it ever had been before. So one, competence, and the feeling was that that is on the horizon, and everyone around the world may see the importance of competence. The second was a surprise to me, was with their view that one of the things at least the United States has done correctly, has at least did at first, was this massive reallocation of resources and spread throughout the country for support with unemployment, with small businesses and so forth and so on. That has not been done in Europe at all. And their comment, and again, not talking about the Asian countries, but just talking about the Western countries, that their view was that the United States is likely at least to recover better than Europe because of this reallocation that did happen. Now, whether or not it's going to happen again, we'll see. Just comments. Thank you again.
Yeah, I'm going to share a slide here that I showed. So can you see that? Or did I not turn slide sharing on?
You haven't shared it yet.
Okay.
There we go. It's coming, and we can see it.
You can. Okay.
Yes.
President Obama was asked about this, and in a moment of frankness, he said, I think this would have given any president a run for his money. And it has given every Western democracy a run for its money. And we have really encountered two problems. One is the continued downplaying on the importance of competent bureaucracies and government as a core to a foundation of our wealth. That was something that everyone believed in the 50s, and for various reasons since the Vietnam War, that has been steadily undermined for various reasons here and in Europe. And that undermining of the bureaucracy and bureaucratic competency has, you can see, it's decimated the Western democracies compared to the Asian democracies. And then the second thing, and it's the one that you mentioned, we've been having a debate in this country for over 100 years about whether one should do massive stimuluses when countries fall on hard times for whatever reason. And there's now a century of research that shows that countries should do the opposite of what families should do. In hard times, families should tighten their belts and countries should loosen their purses. Hard to understand that contradiction. The Germans and the EU, like some conservatives in America, have held on to this antiquated belief that when there's hard times, the country should tighten its belt. And of course, when you do that, you plunge the countries into really serious depressions. Let's move on. Another question.
Thanks.
All right, so we got time for one more question that comes from Hal. Hal, just go ahead.
So more than a question, it seems to me, unless I did something wrong, your tiny URL is case sensitive. And so
yes,
people should know that, because otherwise you're not going to get where you want to go. And it's a great presentation. I now have it up on another machine, but it is case sensitive.
Sorry, can you put
Thank
that
you.
Can you put that link back in the chat? I think I missed it. I've had a lot of people asking me about that link.
yes. I'll send you the PDF as well, which you can send around.
Super. That would be great. Thank you very much.
Thank you.
Apologies, Hal. Carry on. Was that it, Hal? No other questions?
Yep.
Okay, super. Well, we're literally at the 8:45 mark. So if anybody wants to squeeze in a last question, here's your opportunity. I'm going to give it a moment. If not, then we can close out.
I would
Okay.
like Steve to turn on everybody's microphone so we can clap for Elton.
Well, everybody do it.
Great job. Great job.
Great job,
Thank you all.
Elton.
Great
Great
job.
job.
Thank you.
Well done.
Thank you.
Fantastic.
Love
Thank you
you,
very much.
Elton. You rock.
Okay, superb. Well, thanks everybody. I appreciate everyone pitching up today. I think we had a really great presentation. I want to give a shout out to Amanda Giordano for the vision, Georgie as ever, keeping us informed with the network communication, and Katie Cooney for co-hosting. So on that note, I shall bid everyone adieu. Enjoy your Friday and have a wonderful weekend. And
Great job,
thank you very
Stephen.
much. Thanks everyone.
Good job. Thank you,
Thanks,
guys.
Stephen.
Steve,
Have a
great
good
job,
one.
guys.
Okay.
Great job. Happy hour tonight, 6:30, guys.
I
Thanks again, Elton.
Good job, Elton.
Thanks.
Thank you.